by getting a petition going and sending off to community leaders, it could make a real difference in that one community. But not thinking of just that one community, to think of the county as a whole and how we can help the Prince George's County people of Prince George's County to become healthier. There was a video that we watched in class called Weight of the Nation, which talks about how obesity is such a chronic problem in not only adults but also children, leading to high blood pressure, diabetes, overweight, overeating, chronic health problems with your heart, starting at a very young age and then just ending up in early deaths or very debilitated older lives, when these things could be changed right from an early standpoint. So I think that if you haven't already seen Weight of the Nation, that's something that you should watch, because it teaches you to care about not only just what's going on in your community right here, but to think of us as a nation of being obese, a nation of having high blood pressure, strokes, heart disease, and how we can make a difference. Now, there were some things that I thought, in my community, what could I do to look beyond just a family or a patient, but to make a difference right here in my community? Perhaps to run a flu clinic, to give flu vaccines, to sign up for BP clinics, and to get involved in a health fair and get some of my coworkers like you to get you involved in coming together to work at a health fair where we can distribute information to clients and people who would come there on healthier eating, safety. We could get police officers to come and volunteer. I have a nephew who, if you get him and his colleagues to come and distribute information on public safety and gun violence and gun safety. Fire departments. I have family members who work in the fire department. Get them and their colleagues to come out and give out information on fire safety, smoke alarms, smoke detectors, fire prevention, just all of the things that need to be involved in making us a safer community. To address the issue of how we can make sure that there are enough fire hydrants in a community and who we need to write to or file complaints against, a complaint to say that we need safer environments and safer. They're building all these large homes, but we don't have a fire hydrant to put the fire out in case of a fire. So those are things that we might want to consider. I have a lot of things that have come to my mind that I want to share with transportation services. I have family members that work in county transportation services, focus highly toward the elderly. And so a lot of elderly people don't realize that there are public services out here for them to have transportation. Most people know about Metro Access, but sometimes there is a cost involved with Metro Access that many of our elderly seniors cannot afford. And so there's the Call-A-Bus, and then there's other resources out here. But we could have someone come to a fair where they get information about transportation services, looking into having more emergent and urgent care centers out here, because people can't always get to their primary care physician. And if they're closed or busy, and as we all know, most of our doctors are so busy that you spend 4 or 5 hours waiting for one appointment, or you wait 6 months before you can get in and see a specialist, or several weeks before you can see your primary care physician. So that's why the emergency rooms are so full. But with urgent care facilities, we can have more nurse practitioners working there, and patients can get the needs that they need, their needs addressed much quicker. So I learned a lot about evidence-based practice in this community health class, and that's making sure that we give the best practice based on the evidence that's out there, and making sure that everybody's doing something the same way, something that's across the board, across the nation, and everybody's doing it the same way, and we're focusing on evaluating to see the outcome, to make sure that these practices are working, and if they're not working, making changes so that we can find a better way of doing things. Then there's the care. The enough care for Jean Watson has her curative theory in practice, where she says we should think about the mind, the body, and the soul. We focus in on the body a lot in nursing, home care, in the hospital, wherever you work. We focus in on the body, that whole. But what I tell my nurses when I'm training is like, don't focus in on the hole in the body, that wound. focus on the whole body. So that would also consider what a person is feeling. How you feel has a lot to do with how your outcomes. And so if you're not feeling well, or you're not feeling that you're feeling depressed and that issue is not addressed, then you're not going to do the things that it requires for you to get better. And then the spirit. The spirit is a part of the holistic part of your body. So we want to focus in on your spiritual, whatever you feel is your spiritual other part that may be guiding how you feel, especially at the end of life when death is very close and you know that you've lived more years than you have left, and you see people around you dying all the time. That spirituality becomes a really, really important thing, and we as community health nurses have to focus in on those things and touch bases with the patient and what they're feeling, and to connect them if they so desire. It's not to force anything on them, but to give them the opportunity to have a chaplain or someone come to talk to them, or to let them express their way of spirituality, or discuss their feelings about spirituality. So community health nursing is not just about focusing in on a patient with a health disease. It's about families. It's about the community. It's about a county and a state and the nation, and ultimately taking care of our world to make it a better place so that our children and grandchildren will have a better place to live. Thank you.